this is something I think most of you are familiar with. Either you are working with SVF or you have heard more about it. SVF is stromal vascular fraction. So basically, as I said, fat is a rich reservoir of stem cells. So what you can do is, if you harvest fat, which can be done in a very low invasive manner. So it is done with a cannula. Subcutaneous fat is harvested. Cannula is attached to a syringe, and when negative pressure is applied and cannula is rubbed in the space, subcutaneous space, fat is freed up, and because of a negative pressure, the fat tissue will move inside the syringe. So then you can take the syringe back into the lab, and you can use different techniques to get a relatively more rich population of cells. So what you get out of fat tissue is actually a mixed population of different types of cells. Some of them are mentioned. I'll also talk about them. But here I would like to point out, and actually Dr. Mahmood is going to talk more about it, is there are many different techniques of making SVF. So there is a great variation. However, and results are very different. So people have come to me and they said, we have spent so much money, or even the doctors have come to me, that we had our patients spend so much money on stem cell therapy and we did not get any results. So the critical thing is, how much fat are you taking, the age of the patient, the severity of the disease, the duration of the disease. These factors play a very important role. Additionally, I know there are some techniques that you can, there are some machines that can actually get you stem cells out of fat. And efficacy of SVF therapy is basically, it's a numbers game. You have to give enough cells to the patient to get a result. So if you're using a 20-30 ml fat for treating a more, for example, ovarian failure or something more serious, then it is not going to produce the desired results. So numbers. So about 1 ml or 1 gram of fat has about 200,000 stem cells as nucleated cells. We are talking about nucleated cells here when we talk about SVF. So of these, generally for children below 10, it is about 30 to 50 ml of fat that we get. But that fat is sufficient because children that young have a higher number of mesenchymal stem cells as compared to adults. So for children, you can use 30 to 40 ml of fat, children under 10. So the cells you get out of 1 ml fat is about 200,000, and generally I like to use 100 ml of fat from adults. And when you get the nucleated cells out, about 10% of those, literature varies, 3 to 10% are mesenchymal stem cells. Others are endothelial cells, which are also very important. So if you're talking about diseases that need angiogenesis, endothelial progenitor cells can play a very good role. So rather than just using mesenchymal stem cells exclusively for certain diseases, if you're using mixed population, it may produce better results. So for example, kidney disease, you need some angiogenic, if you need angiogenic activity in your patient's damaged area, this is actually fairly good alternative. They also have fibroblasts and also some hematopoietic progenitor cells as well. Did I do something? Oh, okay. So how you go about when a patient walks in, and people today, they get a lot of information about stem cell therapy. Actually, they come and educate the doctors nowadays what stem cells are and what kind of therapy they think they should be getting, and etc., so on and so forth. The first thing you need to do is you have to evaluate your patient, get the patient history, the disease, as I said, the factors that influence the outcome of stem cell therapy, the age of the patient, severity, duration, family background, etc., so on and so forth. And then you have to actually go back to literature. Literature keeps on changing. So what you have read today may not be valid 2 years from now or a year from now. You have to keep on doing this on regular basis, not for every patient. If you're treating similar patients routinely, but you have to get into a habit of looking at literature, what is the latest information about that. And then you have to seek what options would best suit your patient. Now, we have to remember that we are here to help the patient get the best treatment. Not just because I do stem cells and a patient comes in and wants stem cells, I should just give them stem cells. So you have to guide the patient, you have to give them information, different options, and let the patient decide or their guardian decide what that treatment should be. So anyways, this is a generic form, information form that is used to collect data from the patient. Then it is discussed between cell biologists or stem cell experts and the clinicians, and a consensus there has to be a consensus, because stem cell therapy is very expensive. So there should be a consensus that you're not wasting your patient's money. And also, of course, then if in the end the patient is not satisfied, they go around saying that stem cell therapies don't work. Okay, so I have a couple of videos from some of my old patients. Do people want to see it? Okay, so this gentleman had a chronic kidney disease. So for 10 years, he was suffering because of this disease. So he came to us for stem cell therapy. Stem cell therapy was performed. He was almost on dialysis, and alhamdulillah, he produced very good results. And he did not have his all the markers, the creatinine and urea, etc. It normalized without taking any medicines. He was back to normal. There was, I think, an autistic child and a person with spinal cord injury. Okay, now it did not happen that I would have very much liked that person was basically bedbound. He could not get up. He could not move his lower extremities. So ideally, of course, I would have liked to see that he could walk around, etc. But you see, when you think from patient's perspective, I mean, this guy could not even get up from the bed. So after the stem cell therapy, he could raise his upper body just on his own, without any external help. So that was a major achievement for that particular patient. So for us, getting up and walking around does not mean very much. So when you think about the patient's perspective, this is the autistic child. So we cannot hear, but anyways, but that was basically the limit of it. SPF treatment for spinal cord injury, you get some improvement, and again, it varies. This person in the video, he had this injury 10 years back. So it was, I think, fairly remarkable results, considering it was a 10-year-old injury. And he could not move at all, and then he was able to move his lower limbs and partially get up on his own. So I think that's it then. Let's go ahead and we can get back to our presentation. Okay, so autoimmune diseases, we have an ophthalmologist here with us who is going to talk about his results too. But I did a couple of about 6 or 7 patients with Stevens-Johnson disease. It is an autoimmune disorder and it results in impaired vision. Alhamdulillah, all of our patients had positive results. As you can see, the cornea cleared up. This was again done at a different institution. Okay, so why stem cells? Why should we start considering stem cell therapeutics, taking them more seriously? I just have some figures which I downloaded from the net, and I think they are also a little old, even it is going to get better. So the global stem cell market size is about 10.56 billion in 2020. So it is projected that it will cross about 50 billion US dollars in next 5 to 6 years. So why? If a product is not working, it will not generate those kind of resources. So one of arguments in favor of stem cell figures. So it works. There are many, many clinics in US, Europe, and almost everywhere, Middle East, which are offering stem cell therapy to patients. And the reason why patients are opting to choose stem cell therapy is because in cases where there is no option and traditional medicine has already reached its maximum limit, then you can give stem cell therapy option to your patients. Okay, here's another figure about stem cell market size and the future predictions. So there is a lot of quackery in the field. Okay, so people are selling PRP as stem cells. People are using small amount of fat, charging people lots of money when that fat amount of stem cells that they are going to prepare from that amount of fat is not significant. It is not going to give any significant benefit to patient. Okay, ultimately we all suffer because if people remember when first lasers came, there was a laser clinic set up in probably every locality, and people are marketing lasers as permanent hair removal lasers which were not meant for permanent hair removal. So quacks basically actually not only harm their own patients, but they also are harming the profession on the whole. So, so this is important. So first of all, the person who is the clinician has to have proper training. For example, if you have to give intrathecal stem cell infusion, then the person should have ability to inject stem cells into the spinal cord. The person who is preparing the stem cells should have enough experience. Okay, so it is very different. You may have worked in a lab working on stem cells, making stem cells from mice or rabbits or other animals. Doing clinical stem cell therapy is a complete different mindset. Okay, so people who have done lab work, non-clinical lab work, they should not directly jump into it. They should go through proper training before getting involved in stem cell therapy for therapeutic purposes. So technical know-how, of course, it goes both for clinicians and also the lab person, the scientist who is going to prepare the cells. See, you have to be honest with your patients. I have had many patients come to me with ISL disease. The patients are about 3 or 5 years old. ISL is inclusion bodies. For example, Tay-Sachs disease, etc., so on and so forth. So you cannot treat these patients with stem cells. You have to know the limitations of your techniques and your therapeutic agent that you're offering to the patients. You have to provide patients with the information. I'll show you some papers that, I give to the patients. I'll tell them that this is an option. What are the potential risks involved? What are the potential benefits involved? And whatever I say, I have to back it up with proof. And I provide them the literature and let patients decide whether they want to opt for stem cell therapy or not. And then you have to respect patient's decision. You may think stem cell therapy is best option for that patient. If patient doesn't want it, don't force or coerce that patient into getting stem cell therapy. Educating patients, this is a paper I commonly use for osteoarthritis patients. This is a meta-analysis. It has very nice results. It has combined, I think, 50 or 60 different studies and presented the data very coherently. Autistic patients make a fairly large pool of patients who are generally seeking stem cell therapy. So this is one of the papers I use. Okay, so these are the references the information I have given in this presentation. If someone wants to explore them further, they can look at these references. That's all I had to say about this. Thank you for your time and patience and attention. Thank you.